там друковані лежать на початку. Доброго.
Good afternoon, everyone. We greet you at the press conference of the Ministry of Healthcare team, and today we are going to tell you about the achievements of our team and to speak about what patients should expect in 2020. First, the floor is given to Acting Minister of Healthcare of Ukraine, Ulyana Suprun. Welcome. Good afternoon, everyone. Thank you for being with us today. As it was said, we would like to speak about those things in which we succeeded, or to start the work in, and then Pavlo is going to provide information about the plans for 2020. You know, the transformations in healthcare, this is not only about the first level of healthcare. We may compare it with the sports, with the triathlon, which includes swimming, cycling, and running. This is the first stage that is ongoing. This is the first level. It was introduced, and we have some things that we should still need to do. And the second part is cycling. This is changing the hospitals and polyclinics that will happen next year. And the final line is when licensing of doctors will be introduced, and this will increase the quality of medical services. If you completed the first level, it would be great if we continue now our work in order to complete second and third level. Triathlon is the will and the opportunities, and some people say that reform does not work because there were no changes in hospitals, but we did our work at the first level and we see success in the first level. Please tell me who of you signed the declaration with your doctors. So I invite those who didn't to sign the declaration with your doctor. You will see the improvements at that level. Changes in healthcare sector. We had survey. The Institute of Democratic Initiatives held this survey. So this is first, anti-corruption reform was provided. This was important in parliamentary and presidential elections as well. And we see that healthcare also needed reform, and first steps were made, and people wanted to continue. And people approach me at the ministry or during press conferences, and they ask about the next level of reform at the level of hospitals. And people are waiting, and we also are waiting for changes in this level. Today I'm going to speak about the things that were made, because transformation of the system is not only about financing. At the level of financing, we see that in family medicine there were changes in salaries and positive things for patients. First, you can freely choose the doctor. You are not tied to the place of residence. This is a big change, and I believe you felt it yourself. And you can change the doctor if you are not satisfied. Salaries of doctors increased, and some of doctors have 2 times salary or 3 or 4 times their previous salary. Nurses had increases in their salaries, and the patients have clear description what services should be provided. And 70% of Ukrainians are satisfied with their doctors, and now institutions have freedom to earn. Computerization was 3% at the first level in 2018. Now it's at 97%. And computers were provided by local power, and they invested in the first level of medicines, and now there are e-recipes and e-card in pilot programs, and e-referrals and electronic sick leaves will be provided at the first level. Also, affordable medicine. This is the governmental program introduced by Groisman government, and this program was used by more than 8 million of people. And starting 1st of April, the healthcare center took responsibility, and more than 1 million people got their medicine through e-prescriptions, and the majority of these people are over 65, because there were many concerns about whether these people be able to use electronic forms properly. So these are the changes that are ongoing at the civilizational level of our society. Even older people, they get SMS messages, they go to drugstores, and they get their medicines there. E-health. This is the program where electronic data is provided to the system. 28 million of patients are on the list in the register of patients in e-health system. More than 24,000 doctors, and now we have institutions and the system for prescriptions, and there will be referrals and sick leaves. Everything will be done through electronic system of e-health care. So this will be a smartphone state, and also electronic data, statistics for the Ministry and Healthcare Center to see what is going on in reality in the hospitals or in polyclinics. When the service will be paid at the level of hospitals, we will see what services were provided, and you may follow these this data. Everything in e-health is reflected on the site of the healthcare center, and you may see how much money goes to your institution in accordance with declarations signed with the doctor, and you may see the prescriptions, their number, where they were provided, and the age of the patients, and what drugstores provided this drugs. So we will be able to fight corruption in the system due to this transparency, and we will all have this information, and we will be able to demand the best from our medical institutions, from chief doctors, and to get the best and services of the highest quality. Also, procurement through international organizations. We shifted to UNICEF, Suprun, or Crown agents, and we speak a lot about the improvement and quality of medicines, and we were able to buy 4% more of medicines, and we saved money. And before, prices were higher, now the prices are lower at the level of international procurement. We continue our work in this program, and procurement is temporary through these international organizations. Now we created a procurement agency, medical procurement of Ukraine, and together with Prozoro system, we have e-catalog for our hospitals in pilot regions. This is like healthcare Amazon. They have before threshold procurement. The companies may go on the site and information was checked there by us and by Prozoro, and the prices are set, availability and number is set, so they may choose, as any person in Amazon, to choose medicines, expendables, prices, payment, and they're able to pay electronically. So we are living in the 21st century. And these are before threshold procurement, and we will develop it to the agency and with the system of Prozoro, and all hospitals will be able to buy medicines and medical products in order to provide those services that will be paid next year. Next, vaccination. For us, this is a painful issue. When I joined the ministry, the first press conference was here in this premise with the organizations of civil society who deal with vaccination, and we were speaking about a very low level of vaccination. So we see 2016 and 2018 the level during this period increased. A lot has been done, and we buy vaccines at the level, state level, and we are not waiting for the requests of the regions. We have focus point operations. We travel to separate regions, and we vaccinate children at school or in medical institutions, and we increase the quality of those vaccines because we buy it through UNICEF, and a lot has been done, but as you may see, this was not completed in our country. We need to have 95% of vaccinated children, and this is the only way to protect people from the disease, or to protect your children from the disease. You should vaccinate yourself, your children, and recently we had assessment of our program of vaccination carried out by World Health Organization, and we will publish their recommendations. They thought that a lot of positive changes happened, but we need to do more in order to improve in each area to reach 95%. Next week we will start a campaign concerning vaccination of adults against diphtheria and tetanus, and I ask you to go to your doctor and to ask about vaccination and to vaccinate. We have available vaccines, and they are all verified by World Health Organization, or they were checked by FDA, American organization. So these are safe vaccines, and they may protect us from the illnesses that should not exist in the 21st century. Now, public health. In 2016, we adopted the strategy concerning public health. So we have programs, and we take care of health of all citizens of Ukraine, not just separate treatment of some patients. Public health is the basis on which healthcare is built on. Now, starting 2016, the Center of Public Health is active at the state level, and we have 11 regional centers of public health. Until end of year, we hope that all the centers and the regions will work. And next year, we won't pay for them and buy services for public health, and we will provide for them at the level of state and at the level of regions. So this year we started a pilot project, 5 regions and Kiev city, where we change emergency system And in the pilot project, we have financing in order that all the regions until end of year bought and introduced new dispatcher system in order to do it electronically, a GPS-based system. Money was allocated to the regions and the tenders were held, and there are 3 more dispatcher systems that some of these systems are bought in Ukraine, and we have 103. We have training for new specialists for paramedics, and also we provide training for drivers. We increase salaries to the teams, and new protocols were published on how to provide emergency help. So step by step, we have 6 regions this year, then we will have 6 more, and in 3 years we will have the system at the state level to provide emergency help. Cardio centers, as you may know, we had a governmental program co-financed together with regions to build cardio centers, to have equipment, to provide stands. And the first is procurement itself of angiograph. Second part is buying through international organizations of stands, and we bought 25,000 stands, 100% needed. 41 centers in operation, they provide assistance, and there are 73 centers. The rest didn't do repair works. They bought equipment, but they didn't do repair work. So if the cardiac center is not working at the moment in your region, this is a local problem. Money was not allocated, or they didn't complete repair works in order to establish this equipment. Cardiac centers where they work, there was 20% decrease of heart attacks, and we need that all 73 centers be in operation. Next, medical education. One of my favorite topics. A lot of changes were made. 154 doctors and 130 scores for pharmacists, and we have qualification exam, and there are obligatory components. There's a English language structured OSCE exam, and from international medical examination. Also, for nurses, we have training, and we have requirements for master's degree, bachelor degree, and then there will be a junior nurse and training, and we increase the responsibilities of nurses now, and we have medical institution that is whole state institution, center of development of practical training for nurses at the Ministry of Healthcare. So we made a tour, and we spoke with more than 1,000 doctors, and we spoke about licensing of doctors with them, and about their practice, about the requirements to doctors, and we heard the recommendations, and we have a strategy, and we are waiting for the Ministry of Finance to sign the document. Then we will submit it to the Cabinet of Ministers in order to have the law on licensing. And this law is protection for chief doctors in order not to be dismissed. And this is the protection, that the state recognizes them, that they can do their job. And for patients, this is the opportunity. If there are some complaints against doctors, they may apply to the licensing council, then fines may be imposed, or additional training may be needed, or a license may be revoked. So this is the plus for doctors, plus for patients, and for the state. This is the only way in which we will know what doctors we have, where they work, what they do, because now we have the register of medical workers and it is obsolete, and a lot of people from this list, they are not doctors anymore, or they do not do or they are on several positions, so we should understand what doctors we need in order to develop this sector. What is next? 28 years of independence, and during these years we had 22 ministers of healthcare. And this is why only now we have serious transformation of the healthcare system, because they start from scratch each time when the new minister arrives. This resulted in bad situation. Nothing changed for 25 years. And the state, the people of Ukraine, through the Verkhovna Rada, they voted and supported the changes in financing of healthcare system, and we introduced the first part in 1 year. It took 1 year. It started in July last year, so we changed the whole primary level of healthcare. And you may see it if you attend your family doctors. Next year, polyclinics will change and hospitals will change. It will take more time and it will be difficult because many changes are ongoing. But if it is difficult, it doesn't mean that we shouldn't do it. I heard one of the new deputies, he said that if people don't like something, we will remove it and we will remain only things people like. And yesterday we had a day to support our health. Of course, we want to eat everything we want, smoke, drink, do what we like, but whether it will be good for our health, we will see those negative consequences in 5 or 10 years. Sometimes changes that are needed, they are not simple, they are not comfortable, but they should be done. And we as society, as a state, we chose our way to change the system of healthcare in Ukraine in order it to be good for the patient, to have patient-focused approach, and we should help the families to provide proper financing, not to bankrupt families, to focus on preventive medicine, to be more healthy, because today people die 10 years earlier than our neighbors. So this is because healthcare system is not working. So we should change this system. It won't be easy, but I believe that together we will be able to do it. So we should build on what we did during these last years, and we should have proper policies that were adopted and to promote them, to develop them like civilized European countries do, and in several years we will be able to see that the system works like it does in Europe. And now I would like to give the floor to the next speaker, and he will tell you about changes that will happen next year. Now the floor is given to Deputy Minister of Health of Ukraine, Pavlo Kovtonyuk, and he will tell us about the changes that are planned for 2020. Good morning. Let's speak about the next year. Next year we will have implementation of law on medical reform in full, and there will be a program of medical guarantees for all of us, citizens of Ukraine. I will explain this program of medical guarantee. You know about the right for healthcare. We all have this right. It is embodied in the Constitution of Ukraine for many years. We went to the hospitals and we faced the situation that we have the right, but we cannot use it. And the medical guarantee program, for the first time in history, this is the instrument to implement this right, the mechanism to make this right reality. And we have the right to vote, for example, to elect people, but we cannot implement it like we want to. We cannot come somewhere and to say that, for example, I want to elect president. There is a mechanism, there is a date, year, procedure, following which we may implement the right. The state works the same, and the medical sector should start to work in the same way in 2020. And the Verkhovna Rada will adopt the program of medical guarantees. We will have medical services, and these are 6 big blocks. Primary help, specialized help, special in-hospital help, emergency help, palliative treatment and rehabilitation. In 2020, hospitals will provide these services through the new model of payment, money follow the patient. And you may see that in a year at the first level, we shifted to this model, and for specialized help, this won't be so quick and dynamic, but this will happen obligatory, and it will take 2, maximum 3 years then when specialized sector will shift to the new model. I would like to stress that starting next year, this old mechanism of financing of hospitals that was called medical subvents, we won't have it. We will have only the mechanism of payment for services based on the agreements with National Health Care Center. So how it will look for the patients. The system is not difficult. You should remember about several simple things. First, we know about family doctor, the conclusion of declaration, how to get services, about special services. They are divided in 2 parts. We may get it in emergency if something happens, or they may be provided in a planned way. If we are speaking about emergency, we should remember that these services are included in the program of medical guarantees. National Healthcare Service pays for it fully, and we just need to call the ambulance. If there is an emergency, we call ambulance and they drive us to hospitals, and this is for free. If we are speaking about planned services, here we have several important rules we should adhere to in order the healthcare service pay for this. It starts with the simple procedure, and all Europeans know about it, but Ukrainians do not know about it. These services are provided due to referral. You may get it electronically from family doctor. If additional services are needed, referral will be made from specialist, but this is an obligatory condition. Second, we should choose hospital specialist from whom we want to get the service. This choice is really important, and this will be for specialized help, and we will see whether there is a logo of the service, of the national service, and what the list of services they provide in this medical institution, and what services are covered by the state. So now we may go on the site and to see primary level doctors, declaration services, or to go to the institution and there will be a list of what services are provided. The same will be with the specialized institutions. They will provide this information on site or in their premises. After you have chosen the institution and the doctor, then the appointment with the doctor will be made. There shouldn't be queues and chaos, so you will be able to get there and to get the service. So if you follow the simple algorithm, then the National Healthcare Service will pay for these services. If this service is provided and quality is low, or they reject our request, we'll be able to provide feedback to healthcare service. So this is the hotline. Short number is 1677. What about medicines? I would like to focus on this topic and to say two main things. First, all medicines that are needed in hospitals for the service that is paid by National Healthcare Service and that is provided in accordance with the national list of medicines. They are included in the service and they should be provided. So we should not go to drugstores and to bring it to hospitals. Second case, sometimes we need expensive drugs. And the cost of the service sometimes is much lower than the medicine cost. And this is usually when we treat oncology, and for this we have centralized procurement of such medicines, and the minister mentioned this, especially concerning oncology. The medicines are bought through international organizations and are brought to hospitals. And they become a part of medical service that are provided to us. Some services won't be included in the guaranteed package. And for these services, these institutions will be able to get money. What are these services? First, these are non-medical services. This is, for example, better service, better catering, better room. This is not directly related to treatment. And second, services without referral. If we go without any referral from the doctor, the service will be paid not by national service, but by patient or by his private insurance, or if someone else covers these expenses, for example, local power. If we are speaking about medical services, some medical services won't be included into guarantees. These are not critical for our health. For example, stomatology, except children, or urgent stomatological treatment. The full list of these services, it will be updated by the National Service and will be published. Now we are going to speak about the work that should be done in half a year that we have in order to successfully implement it. First, the Ministry and the National Healthcare Service works on normative acts in order to introduce these changes. They will be adopted by the next government, and this will be their work. The next parliament should adopt the law on state budget, in which they should envisage enough finances for implementation of these obligations. And the draft is prepared by our ministry and the Ministry of Finance. It shouldn't be done from scratch. And parallel local power, hospitals themselves, they should do their homework. First, they should complete the reorganization, and this is the autonomization of institutions in order to conclude the contract with the national service. Then they should computerize their institutions in order to conclude declarations and to report to the National Healthcare Service. If this work is done, we will successfully launch program of healthcare guarantees at the level of specialized services, and we will see competitiveness, positive changes in salaries of doctors, and understandable rules for patients how to get the service, and more civilized system of provision of medical services for all of us. And at the end, I would like to say that during the meeting of the government and the Verkhovna Rada will have obligation to work on things that are incorporated in our system that works on the primary level. I would like to say about two such things. First, we achieved and we did a very important thing. We separated medical services and financing of medical services from politicians and politics. National Healthcare Service was created. This is technocratic independent body that directly pays to medical institutions for medical services. This is done automatically online, and there is no officials between the system and the institution. So there are no officials who redistribute money in the system, and this is really important. And this is independence, and this institution, this healthcare service, it is independent and transparent. And at the first level, we may see how money is spent. We as taxpayers pay this money, and we may follow this money to each doctor, to each drugstore, how they spend this hryvnias for us, for medicines. And we need to develop this electronic system, and we should not do it on paper. We should not do it in the rooms. Everything should be public. If these principles are preserved, I believe that next year we will be able to see new achievements in our healthcare at the level of hospital and specialized services. Thank you. Now you will be able to ask questions. First, please introduce yourself before asking the question. We have a lot of people who want to ask, so 1 or 2 questions each, please. Question to Ulyana. So we are news of Suspilna. About cholera vaccine certification, and what about those soldiers that were not vaccinated? Or maybe we should establish cooperation with the ministry. What about the situation in Africa? About vaccination of soldiers, this is the responsibility of Ministry of Defense or Ministry of Internal Affairs. We have cooperation with them concerning bringing vaccines in order to provide permit to bring it to Ukraine if they are not registered in Ukraine, because there are many vaccines that are not registered in Ukraine. But then you may submit this question to them, you may ask them. But I know that documents were signed in order to bring vaccines to Ukraine that were specifically for our soldiers that go to have peacekeeping missions with our partners abroad. In Ukraine, we do not have it, but it doesn't create obstacles. You may bring it to Ukraine, and you can bring any medicines or vaccines to treat oncology. If this is for individual patient, the patient or his relatives or the Ministry of Defense, they may bring these medicines if everything is properly documented through customs office and if it is used for the patient, not to sell this drug. And the Ministry of Defense, they bring such vaccines for the soldiers in order to vaccinate them. Next question, please. Anna Levchenko, Interfax, Ukraine. Question to Pavlo Kovtonyuk. What is your forecast about voting of the new parliament concerning program of healthcare guarantee? I saw in Facebook that there will be committee and those who will be on this committee. What about your forecast? I do not like to gamble. I do not like to forecast and to comment on the actions of the parliament. But I have hopes that this budget will be adopted in time and in the full scope in order to implement this program successfully. We provided calculations to the Ministry of Finance and we need more money because it is impossible to launch this reform in hospitals without proper funding, and I hope that the Parliament will support it in due time. So maybe we will speak about it in the budget, during budget process, because I believe that my words now may influence the process, but I believe that we will have much more money that we didn't have before. Ukrainska Pravda, Irina Grets. Question to Ulyana and Pavlo about the place of private medical institutions in specialized area starting 2020. Thank you for your question. System itself, how it is built, from one side, it makes communal institutions look like private because they work freely. They cannot only go bankrupt and to withdraw the funds, but at the same time all the limitations are lifted. They may compete with private may compete with the communal enterprises. And when we started reform at the primary level, private sector, they really contributed, and each fifth declaration was concluded with private doctor. And with specialized help, we will see maybe the same. I see that they are careful about this issue, but there are active negotiations, and I believe there will be heated negotiations with the service. And we should create single healthcare area. Of course, defense sector should be separate. Whether it is communal or private or Feofania or National Academy of Sciences, we should have access to each hospital. And we also communicate with our institutions, defense institutions from the Ministry of Defense and the National Guard. Next year, they will start negotiations in order to sign contracts with the National Healthcare Service to get access if they have good specialists. We should have single healthcare space, and the patient should be in center. So doctors, they have possibility to work where they want to work, and there is equal access for patients, and the contracts may be signed with the healthcare service. And we patients have the right to address any institution. And what about free diagnostics that should we wait it in 2020? This is the question from Gramaska. Free diagnostics is the part of medical guarantee program. It should have started with this program. And according to the law on medical reform, we have the plan to introduce these changes, and it envisages that we will do it at the primary level in 2018, then 2019 pilot projects, and 2020 all types of help. And two pilot projects, even three, were in 2019. First, this mechanism was piloted in Poltava Oblast, and two pilot projects are now working. This is Poltava Oblast and emergency assistance, and about diagnostics. We are working on it, but we've decided not to launch it on the date we've planned, because the institutions and the healthcare service, we saw that they need to do more work. So starting 1st January 2020, these services will be provided in accordance with the medical guarantees program. So Inter TV channel. Question to Ulyana Suprun on transplantation. 112 million were allocated for this. Now Ukrainians get this transplant abroad, and Ministry of Healthcare provided through Facebook that those now who suffer from problems with blood, they will get the service later. So we have first results concerning single information system of transplantology. We have 8 registers, and they should communicate among themselves. And we bought a register on transplantation of bone marrow, and we have transplant coordinators. We introduce such specialty, and we have 40 doctors who have certification in this, and they can work in hospitals, and 4 hospitals will provide such help, the services of transplantation, and step by step we will do it. This is a complex process. Until the end of the year, we hope the system will work, and starting next year we will be able to provide the services. About the money, some of the money that we had for equipment, it partly went to the hospitals that need it. This year we are searching for hospitals in which some equipment is lacking, because the diagnosis should be provided, the death of brain should be established in order to include these people in the program. And also we need proper laboratory equipment in order that those who want to be donors, they be able to provide their proposal, and then some diagnostics should be made, analysis, tests, in order to include them in the system. And I hope that Pavlo will answer the second question, and will add about transplantation. There is a wrong opinion that there is no transplantation in Ukraine and it should be launched. But we have transplantation in Ukraine, and we need to have more of it. That's why we need and the law should bring the transplantation at the higher level. And as Minister said, there are several key areas in this. First and the main is the register in order to quickly and efficiently find donors for people to have the basis. And also this register should be integrated into national registers. And the next is transplant coordinators training, those who search and also to prepare those medical institutions where this transplantation will be carried out. We identified some of them. Well, they will be the first ones, and the financing will be provided in 3 areas, and we have progress in each of them. And you should have right expectations. It cannot be done in 1 day. This is difficult, complex work, and we have progress in all the areas. About treatment abroad, I support fully the importance of transplantation program. There should be proper alternative. And this year, in half year, we sent more people abroad than during the last year, 301 person, and the request is increasing. And in the framework of the budget that was allocated by the parliament, we implemented this budget, and we provided an announcement for the patients, and I hope that this program will continue next year. But gradually, transplant program will be replacement for the previous program. Thank you very much. Our time is off. Thank you. Goodbye.
Шановні колеги, зараз розпочинається наступний захід. Якщо ви